15. Shocking reasons that make you lose your balance after 60. The 10th is the most frightening. Have you ever felt that your balance is no longer the same? Ever had that strange feeling of instability when standing up or walking? What if I told you that there are hidden causes that could be hindering your mobility without you realizing it? Losing your balance is not just a natural consequence of aging. There are factors that accelerate this loss and put your safety at risk, often silently. The good news is that, by identifying the causes, it is possible to act to regain stability and prevent falls. In this video, you will discover 15 surprising reasons that directly affect your balance after the age of 60. Some are obvious, others may surprise you. But reason number 10 is the most dangerous, and almost no one talks about it. Let's get started. What causes loss of balance after 60? Have you ever felt dizzy or unsteady when walking? After the age of 60, loss of balance can become a real problem, increasing the risk of falls and injuries. But why does this happen? Aging affects muscles, joints, and even the nervous system, compromising stability. In addition, diseases such as labyrinthitis, peripheral neuropathy, and even nutritional deficiencies can aggravate the situation. But the good news is that there are ways to prevent and even reverse this loss. Discover the main factors that affect your balance and how to act to maintain mobility and safety on a daily basis. Is it possible to regain balance in old age? Losing your balance does not mean accepting falls as part of aging. With the right stimuli, the body can regain stability and avoid accidents. Muscle strengthening exercises, proprioception training, and even dietary changes can make a big difference. Additionally, identifying and treating problems such as labyrinthitis and vitamin deficiencies can restore safety when walking. Balance can be recovered with dedication and simple practices on a daily basis. Do you want to know what are the best strategies to feel more firm and confident? At the end of the videos, I'll tell you 5 powerful ways to regain balance and avoid falls. But before that, I'll show you the reasons that make you lose your balance. 15. Shocking reasons that are causing you to lose your balance after 60. 1. The habit that is weakening your muscles and putting your mobility at risk. Have you ever stopped to think about the impact that a sedentary lifestyle has on your balance? Many people believe that the loss of stability with age is inevitable, but the truth is that one of the biggest villains of mobility is the lack of physical activity. Over the years, the body goes through a natural process of muscle mass loss, called sarcopenia. However, when a person leads a sedentary life, this loss happens in an accelerated way, making the muscles weak and unable to offer the necessary support to the body. This directly affects the ability to walk safely, climb stairs, and even get up from an unsupported chair. In addition, the lack of movement contributes to the stiffening of the joints, reducing flexibility and making movement difficult. And it doesn't stop there. Blood circulation is also impaired, reducing oxygenation of the muscles and brain, which can cause dizziness and increase the risk of falls. The good news is that it is never too late to change this scenario. Simple exercises such as daily walks, stretching, and muscle strengthening can make a huge difference in your stability and confidence when moving. If you spend a lot of time sitting or avoid physical activity, you may be putting your safety at risk without realizing it. And next, let's talk about a nutritional problem that can further compromise your balance. 2. The dangerous nutritional deficiency that can leave you taut and without strength. Do you feel dizzy, weak, or tingling in your hands and feet? These symptoms may be signs of a silent problem that affects many people after the age of 60. Vitamin B12 deficiency. Vitamin B12 is essential for the functioning of the nervous system and for the production of red blood cells, which carry oxygen around the body. Over the years, the absorption of this vitamin by the body can decrease due to changes in the digestive system, use of certain medications, or even changes in diet. When B12 levels are low, the brain may have difficulty communicating with the body, directly affecting motor coordination and spatial perception. This can result in loss of balance, frequent falls, and even difficulties walking in a straight line. In addition, prolonged deficiency can lead to memory problems and mental confusion, further aggravating the risks. Fortunately, this problem can be easily identified through blood tests and treated with dietary adjustments or supplementation. Foods such as meat, eggs, milk, and fish are rich sources of vitamin B12 and should be part of a balanced diet. If you've been feeling more unstable lately, it might be time to check your levels of this essential vitamin. But that's not the only nutritional factor that can compromise your balance. Next, let's talk about a simple mistake that many people make and that can have serious consequences. 3. Is your body asking for water? Dehydration that impairs your balance without you noticing. Do you feel dizzy when you get up? Ever had that feeling of sudden weakness for no apparent reason? It could be that your body is dehydrated and you haven't even noticed. Over the years, the feeling of thirst decreases, causing many people to drink less water than they should. In addition, some medications frequently used in old age, such as diuretics and antihypertensives, increase fluid loss. The problem is that dehydration doesn't just affect dry mouth or dark urine. It directly compromises your balance and increases your risk of falls. When the body doesn't have enough water, blood volume decreases, which can lead to a drop in pressure and make it difficult for the brain to irrigate. This causes dizziness, vertigo, and even fainting. In addition, the lack of fluids impairs the functioning of muscles and joints, making movements slower and less coordinated. The good news is that the solution is simple. Increase fluid intake throughout the day. Water, natural teas, and unsweetened juices are great options. The ideal is not to wait to feel thirsty to drink water, but to create the habit of always keeping a bottle nearby. If you often feel dizzy or unsteady when walking, it may be that your body is in need of hydration. But that's not the only issue that can affect its stability. In the next topic, we will talk about a condition that harms the feet and can make you lose your balance without realizing it. 4. The disease that can make your feet fail when you need it most. Have you ever felt numbness, tingling, or loss of sensation in your feet? These can be signs of a serious problem that affects millions of people and can directly compromise your balance. Diabetic neuropathy. Diabetes is a chronic disease that, when left unchecked, can cause nerve damage, especially in the feet and legs. This nerve damage reduces the body's ability to sense the ground when walking, making movements less precise and increasing the risk of trips and falls. In addition, blood circulation can also be affected, making muscles weaker and reducing the body's ability to respond to changes in position. Another major danger of diabetic neuropathy is the loss of perception of pain in the feet. This means that small bruises, calluses, or infections can go unnoticed, further aggravating the situation. Many people with this problem end up stepping the wrong way, straining joints and making it difficult to be stable when walking. To avoid complications, it is essential to keep glucose levels under control, perform regular exams, and adopt special foot care, such as wearing appropriate footwear and moisturizing the skin. If you have diabetes and have noticed that you are losing your balance more often, it is time to pay attention to your body's signals. But that's not the only condition that can cause dizziness when walking. In the next topic, we'll talk about a problem that can make you feel dizzy every time you get up quickly. 5. Do you get up and feel dizzy? That may be the hidden reason behind it. Have you ever stood up quickly and felt intensely dizzy, as if you were going to faint? This sensation can be a sign of orthostatic hypotension, a condition that affects blood pressure and directly compromises your balance. Orthostatic hypotension occurs when there is a sudden drop in blood pressure when changing positions, such as when getting out of bed or a chair. This is because, over the years, the circulatory system can become less efficient at adapting to these changes, leading to a temporary decrease in blood flow to the brain. The result? Dizziness, blurred vision, and even fainting. Several factors can contribute to this problem, including dehydration, use of high blood pressure medications, diabetes, and even lack of physical activity. In addition, prolonged periods of rest or sitting for a long time can further aggravate the condition. To reduce the effects of orthostatic hypotension, some simple strategies can help, such as standing up slowly, moving your feet before standing up, and staying well hydrated. In more severe cases, an adjustment in medication or specialized medical follow-up may be necessary. If you've experienced episodes of dizziness when standing up, don't ignore this sign. This condition can considerably increase the risk of falls. And, speaking of hidden risks, in the next topic, we will reveal a silent danger that may be hidden in the medications you take every day. 6. The danger. Hidden in your meds. Do you know if they're affecting your balance? Have you ever felt dizzy or drowsy after taking a medicine? Many people don't realize it, but some medications can have side effects that directly compromise balance and increase the risk of falls. High blood pressure medications, anxiolytics, antidepressants, muscle relaxants, and even pain medication can cause dizziness, weakness, and slowed reflexes. This happens because some of these substances affect the central nervous system, reducing the body's ability to react quickly to changes in position or small imbalances when walking. Another common problem among the elderly is the use of multiple medications at the same time, known as polypharmacy. The interaction between different drugs can potentiate unwanted side effects, further increasing the feeling of instability. If you have been feeling dizzy, or have noticed that your balance is no longer the same, it may be interesting to review your medication with a doctor or pharmacist. In some cases, adjustments in doses or changing medications can make a big difference in your quality of life and safety. Now that you know how remedies can compromise your stability, let's talk about a lesser-known problem, but one that may be inside your ear and affecting your balance without you realizing it. 7. What's going on inside your ear could be causing you to lose your balance. Have you ever felt dizzy when you turned your head quickly or when you got out of bed? This can be a sign of problems in the inner ear, one of the main responsible for your balance. Inside the ear is a structure called the vestibular system, which works together with the eyes and brain to maintain the stability of the body. Over the years, this system can change, resulting in dizziness, vertigo, and a feeling of unsteadiness when walking. One of the most common conditions is benign paroxysmal positional vertigo, BPPV, which occurs when small crystals inside the inner ear shift, confusing the brain and making the person feel like the environment is spinning. In addition, inflammation, infections, or diseases such as labyrinthitis and Meniere's disease can directly affect balance and hearing. Symptoms can range from mild dizziness to intense crises that make it difficult to even stand. Fortunately, many of these problems are treatable. Vestibular rehabilitation therapies, specific exercises, and in some cases medications, can help regain balance. If you've been experiencing frequent dizziness, or a feeling like you're being pulled to one side, it may be time to see an ear and balance specialist. But ear problems are not the only ones responsible for this loss of stability. In the next topic, we'll talk about neurological diseases that directly affect your ability to stand firm when walking. 8. What does your brain have to do with it? Neurological diseases that compromise your balance. Have you ever had the feeling that your body doesn't respond as fast as it used to? Or have you noticed that you're stumbling more than usual? This may be related to neurological problems that directly affect balance. The brain is the control center for all body movements. It receives information from the muscles, eyes, and inner ear to adjust posture and maintain stability. However, some neurological diseases can compromise this system, making motor coordination difficult and increasing the risk of falls. Diseases such as Parkinson's, Alzheimer's, stroke, and multiple sclerosis affect the way the brain processes balance signals. In the case of Parkinson's, for example, tremors and muscle stiffness make movements slower and more unstable. A stroke, on the other hand, can cause weakness on one side of the body, changing posture and making it difficult to walk. In addition, cognitive problems can reduce the perception of space and the ability to react quickly to an imbalance. Therefore, people with neurological diseases may have more difficulty avoiding falls. If you have noticed changes in your coordination or notice that your stability is no longer the same, seeing a neurologist may be essential. And in the next topic, we're going to talk about a problem that affects millions of people and may be making their joints stiffer, making it difficult for them to move. 9. Rusty joints. Find out how it can destabilize you. Have you ever found it difficult to get up from a chair or notice that your knees crack when walking. These can be evidence that your joints are losing mobility, and this can compromise your balance. Over the years, the cartilage that protects the joints can wear down, leading to a condition known as osteoarthritis. This condition causes pain, inflammation, and stiffness, making movement more limited and making it difficult to be stable when walking. In addition, when we feel pain when moving, we end up adopting incorrect postures and compensating for movements, which can further destabilize the body and increase the risk of falls. Another worrying factor is that the loss of mobility in the joints can lead to a sedentary lifestyle. And, as we have already seen, the lack of physical activity weakens the muscles, further worsening the balance. The good news is that there are ways to minimize these effects. Low-impact exercises, such as stretching, water aerobics, and Pilates, help keep joints healthy and functional. In addition, controlling body weight reduces the strain on the knees and hips, decreasing pain and improving mobility. If you feel like your joints are rusty, it may be time to look for alternatives to maintain flexibility and avoid future limitations. And in the next topic, we're going to talk about one of the biggest enemies of balance: muscle weakness. 10. Weak muscles. Find out why this is one of the biggest enemies of your balance. Have you ever had difficulty climbing a step or getting up without support? This can be a sign that your muscles are weaker than they should be, and this directly affects your balance. The loss of muscle mass, called sarcopenia, is a natural aging process. From the age of 30, we begin to lose muscle progressively, and this loss accelerates after 60. Without strong muscles to support the body, staying stable when walking or changing positions becomes more difficult, increasing the risk of falls. In addition, weak muscles affect posture. When the core, muscle group of the abdomen and lower back, is weakened, the spine becomes misaligned, impairing weight distribution and causing imbalances. This can cause small irregularities in the floor to become major obstacles. The good news is that muscle weakness is not irreversible. Strengthening exercises, such as light weight training, Pilates, and walking, help maintain muscle strength and endurance. The sooner you include physical activities in your routine, the better your stability and independence will be. If you've noticed signs of muscle weakness, don't ignore it. Staying active may be the secret to avoiding falls and living more safely. But in addition to muscles, there's another silent factor that may be disrupting your balance: hearing loss. In the next topic, we will explain how this happens. 11. Don't you hear as well as you used to? This could be causing you to lose your balance without you knowing it. Have you ever felt like your hearing isn't the same anymore? Or do you have trouble perceiving sounds around you? What few people know is that hearing loss can directly affect balance and increase the risk of falls. The ear is not only responsible for hearing, it also plays a key role in controlling the stability of the body. In the inner ear, there is the vestibular system, which works together with the eyes and muscles to help the brain identify the body's position in space. When hearing is impaired, this system can be affected, hindering the ability to remain stable when walking or changing positions. In addition, people with hearing loss tend to rely more on vision for balance. This means that environments with poor lighting or sudden changes in light can disorient them, making falls more likely. Another worrying factor is that hearing difficulties can reduce the perception of surrounding dangers, such as an approaching car or an obstacle in the way. Fortunately, hearing loss can be diagnosed and treated. Wearing hearing aids improves not only hearing, but also the ability to balance. If you've been experiencing unsteadiness when walking and have noticed that your hearing has worsened, it may be time to see a specialist. But that's not the only sense that can compromise your balance. In the next topic, we will talk about a vision problem that can drastically increase the risk of falls. 12. Is your field of vision shrinking? What you can't see can bring you down. Have you ever tripped over something you didn't see on the ground? Or did you find it difficult to walk in dark environments? Vision loss is one of the main factors that compromise balance, significantly increasing the risk of falls. Vision plays an essential role in spatial orientation and obstacle detection. With aging, problems such as cataracts, glaucoma, and macular degeneration can reduce the sharpness of images, limit the field of vision, and impair depth perception. This means that steps, potholes, and changes in the floor can go unnoticed, making any hike a challenge. Another common problem is slow adaptation to light. Environments with dim lighting or sudden changes in brightness can disorient the brain, making it difficult to balance. In addition, when vision is impaired, the body needs to compensate for this loss with other senses, such as hearing and touch. If these senses are also compromised, the risk of falls increases even more. The good news is that many visual conditions can be corrected with glasses, surgery, or specific treatments. Regular eye exams and ensuring that glasses are correctly prescribed are key measures to maintain clear vision and safe mobility. If you feel that your vision is no longer what it used to be, don't ignore this sign. But in addition to hearing and vision, there are other surprising factors that can affect your balance. In the next topic, we will talk about the impact of stress and anxiety on this process. 13. Stress and anxiety. The psychological impact that can make you lose your balance. Have you ever felt your head light or had the feeling of floating in times of stress? What few people know is that the emotional also directly influences balance. Stress and anxiety can cause changes in the nervous system, affecting the way the brain processes the sensory information responsible for the body's stability. During episodes of anxiety, it is common for breathing to become faster, leading to hyperventilation, which reduces carbon dioxide levels in the blood and can cause dizziness, blurred vision, and feelings of instability. In addition, chronic stress increases muscle tension, especially in the neck and shoulder region, which can affect blood flow to the brain and cause vertigo. Anxious people also tend to avoid certain movements for fear of falling, which leads to a sedentary lifestyle and muscle weakening, further aggravating the loss of balance. The good news is that there are effective ways to manage stress and improve body stability. Techniques such as deep breathing, meditation, and physical exercises help reduce tension and improve motor coordination. In addition, seeking psychological support can be essential to deal with anxiety and regain confidence in movements. If you feel like anxiety or stress is impacting your balance, it's time to pay attention to it. And in the next topic, we will talk about an essential factor for stability that many people ignore: sleep. 14. Lack of sleep. The hidden reason behind your instability. Have you ever woken up feeling a heavy head and had trouble walking right out of bed? Sleep deprivation can be one of the main causes of loss of balance and often goes unnoticed. Sleep is essential for the proper functioning of the brain and nervous system. During rest, the body processes sensory information, regulates muscles, and strengthens reflexes. However, as we age, sleep quality can worsen due to factors such as insomnia, sleep apnea, or chronic pain. Poor sleep compromises the brain's ability to coordinate movements and react quickly to imbalances, increasing the risk of trips and falls. In addition, the fatigue generated by sleepless nights can make the muscles less responsive, making the steps unsafe and the posture more unstable. Another worrying factor is that sleep deprivation can cause dizziness and disorientation, similar to the symptoms of neurological or vestibular problems. Often, the person does not realize that extreme fatigue is affecting their stability until they fall. If you have difficulty sleeping well, it is essential to look for ways to improve your sleep quality. Creating a quiet nighttime routine, avoiding caffeine before bed, and seeing a doctor to evaluate sleep disorders can make all the difference. And in the next topic, we will talk about a condition that weakens bones and can make falls even more dangerous: osteoporosis. 15. Osteoporosis, the weakening of bones that can compromise their balance. Did you know that osteoporosis doesn't just affect your bones, but it can also impair your balance? This silent problem makes bones more fragile and dramatically increases the risk of dangerous falls. Osteoporosis is a condition characterized by the loss of bone density, making bones thinner and susceptible to fractures. With advancing age, this bone loss accelerates, especially in postmenopausal women, due to the drop in estrogen levels. What many don't know is that this fragility can also affect body stability. When the bones of the legs, hips, and spine are weakened, posture changes, and the body may lose the ability to stay properly aligned. In addition, people with osteoporosis can develop chronic pain, reducing mobility, and making movements more rigid and unsafe. All of this contributes to a higher risk of serious trips and falls. The good news is that osteoporosis can be prevented and controlled with healthy habits. Light impact exercises, such as walking and weight training, help strengthen bones. In addition, maintaining a diet rich in calcium and vitamin D, and doing periodic exams to assess bone density, are essential to avoid complications. If you want to preserve your stability and avoid fractures, taking care of your bone health is essential. But in addition to the causes that affect balance, it is important to recognize the signs that something is wrong. In the next topic, we will talk about the symptoms that indicate that your balance may be compromised. Worrying signs that indicate your balance is compromised. Have you ever felt like your body doesn't respond like it used to? Small signs may indicate that your stability is compromised and that you may be at risk of falling. Identifying these symptoms early can be the key to avoiding serious accidents. One of the first signs of loss of balance is frequent dizziness or vertigo. If you feel like the environment is spinning or have trouble standing firm when walking, it could be a sign that something isn't working well in your vestibular or nervous system. Another worrying symptom is the feeling of weakness or instability when standing or moving. If you need to lean on furniture, feel that your legs are shaky, or have difficulty changing direction when walking, it could be that your muscles are weakened or your joints are compromised. Blurred vision or difficulty seeing details on the floor can also be a risk factor. Many falls happen because the person does not notice steps, holes, or objects in the way. In addition, a constant fear of falling can be a warning that your confidence in mobility is waning. People who avoid walking due to insecurity end up becoming more sedentary, which further aggravates the problem. If you've noticed any of these signs, don't ignore them. Seeking medical help and strengthening the body are essential steps to regain stability. In the next topic, we will show you 5 powerful ways to regain balance and avoid falls. 5 powerful ways to regain balance and prevent falls. Have you noticed that your balance is no longer the same? The good news is that there are effective ways to regain stability and prevent falls, ensuring more safety and independence in everyday life. First, muscle strengthening. Minking strong muscles is essential to sustain the body and react quickly to any imbalance. Exercises such as squats, walking, and Pilates help strengthen your legs, core, and improve stability. Second, specific exercises for balancet intuitivos, such as standing on one foot, walking in a straight line, and practicing yoga, or Tai Chi Chuan, help improve motor coordination and body perception. The more you train your balance, the more confidence you gain in the movements. Third, posture improvement. The keeping the spine upright, distributing the weight equally on the feet, and avoiding leaning the body forward are practices that make all the difference. Adjusting posture reduces strain on joints and improves mobility. Fourth, proper hydration and nutrition. Bobbing water regularly prevents dizziness caused by dehydration. In addition, a diet rich in calcium, vitamin D, and protein strengthens bones and muscles, helping to maintain a firm and resilient body. Fifth, regular consultations with specialists. MIGE follow-up, eye exams, hearing evaluation, and consultations with physiotherapists are essential to identify and correct problems that can affect balance. Small changes in routine make a big difference in your safety. And finally, let's leave a special message that can transform the way you take care of your balance and your health. Maintaining balance goes far beyond preventing falls. It means preserving your independence, your safety, and your quality of life. Every firm step you take today is an investment in your future. If you've noticed that your balance is no longer the same, don't ignore the signs. Small changes can make a big difference. Strengthening the body, taking care of nutrition, staying hydrated, and seeking medical help when necessary are attitudes that protect your health and ensure more autonomy. It's never too late to improve. With dedication and healthy habits, you can regain stability and continue enjoying life with confidence and security. Now that you know the main reasons for loss of balance and know how to combat them, how about starting today? Your future depends on the choices you make now.